Professor Anshi. He's from University of Tokyo, and today he will give a talk on position of embodiment in children's rehabilitation. So if you are ready, so the floor is yours.
So thank you for this great opportunity, and thank you for organizing this wonderful conference. And I'm very happy to give a talk in this great event. So my name is Chian from the University of Tokyo. My expertise are rehabilitation robotics. And today I talk about how children with motor impairment acquire the embodiment through rehabilitation. I hope you can enjoy my talk. So actually, I have been working on rehabilitation for the post-stroke patient or Parkinson's disease patient. But recently, I started on working on children's rehabilitation. And today I talk about rehabilitation for children. So nowadays, the increase in late childbirth and advance in medical care. So if the baby was born in a low weight, he or she could not survive previously. But now they could survive. It, of course, good thing, but this infant may have cerebral palsy and it causes motor impairment. This right movie shows 4 years old child with CP, and you can see that her walking is not smooth and could only walk about few steps or 100 steps. So improving the motor functions and the somatosensory system of these children is crucial for our society. So the children with CP suffer from motor impairment, which I would say impaired body embodiment. So their body representation, in other words, body schema, is defined as a relationship between sensory input and body movement. And it is impaired due to the partial damage to the brain for the children with CP. So actually, it is very important to newly form this body representation according to the development stage. However, rehabilitation for this kind of children is very different from the adult. So for the adult, actually, like us, we already developed the body representation in our brain, and we have to relearn it after brain injuries. But for children with CP have less experience on standing and walking, therefore they have to build new body representation. So it is actually not rehabilitation, but it's habilitation. So in our study, we focus on the intervention of the physical therapist, PT, and we hypothesize that this PT's intervention helps formation of the body representation of the children. So this movie actually shows an example of a child with CP. You may see that this left movie that she cannot actually touch her foot fully on the ground. So in this case, she cannot fully utilize tactile sensation and proprioception. So it does not really contribute to the body representation. So to this child, physical therapist, PT, add mechanical stimulation to the child's foot, knee, or hip. And after 20 or 30 minutes rehabilitation, her feet could fully touch the ground. And in this sense, she could utilize those sensory input and construct body representation. So based on this hypothesis, we aim to first clarify how the physical therapist intervenes their feet. And also we measure the motor performance of the children to validate this intervention's effect. And we also try to develop the rehabilitation device. You can see that her posture is stabilized in this right movie after the PT's intervention. However, after a few days, her posture returns to this right one. So continuous support rehabilitation is very important for these children. And we aim to develop the device which could be used at home to receive the rehabilitation as PT does. So we conducted an experiment to assess PT's intervention and its effect on the motor performance. So we have 19 children with CP and 23 typical development children. So this is an example, again, the example of the patient. Before the physical therapist therapy, he could not really maintain the posture stably. But after 5 minutes rehabilitation, balance function seems to improve. So to evaluate how PT intervenes the foot and how their motor function recovers, we use this kind of insole type pressure sensor to measure where the physical therapist stimulating the sole of the foot and how much force is applied. And to evaluate the motor function, we use surface EMG and we measure the center of pressure underfoot, and also we use motion capture system. So this slide shows a brief result of the scale of the PT's interventions. We found that physical therapists try to shape the foot and also move individual fingers to form the body representation. And the amount of the force applied to the foot is about 10 to 20 newtons for each location. The interventions target is first to form the medial and transverse arch, and the other one is to dorsiflex their fingers. Why these interventions are important? So the mechanical structure of the arch absorbs the impact of the feet touchdown, and it stabilizes the posture. In addition, stimulation to the intrinsic small muscles by moving these fingers could improve the sensory input detection. As you may know that muscles act not only as an actuator, but it works as a sensor to detect motions. So by detecting this small subtle posture change through these small intrinsic muscles, it can control extrinsic large muscle to stabilize postures. So the physical therapist improves mechanical structure of the body and adds sensory input to enhance better embodiment. Now I show how physical therapist intervention affects motor performance. Center of pressure while standing upright becomes smaller compared to the before the therapy and after. And it means that the posture is stabilized after the interventions. And we also measured 4 extrinsic muscles here. And interestingly, we found that most of the muscle activation decreased after PT's interventions. So it means that those children with CP could maintain their posture without activating large muscles. Also, we evaluated the posture while the patient reaches their hand forward, volantly, and we measured the maximum reachable distance. So actually this task requires more dynamic stabilities. And it was found that those children with CP improved the joint coordination, and they could reach the hand farther and get closer to TD child. So previously, child had to flex their knee, but they could extend their knee and plantar flex their ankle after PT's intervention to maintain the postures. In addition, we also evaluated psychological effect of the therapy. So here, we gradually change the target toy, which is in front of the patient, and ask them if they think they could reach to the target. And we collected the answer and calculated perceived reachable distance. And we found actually it is increased significantly after the interventions. So this indicates that actually self-efficacy of the CP children became higher, so that they have more feeling to interact with external world. And also based on these like PT's intervention skill, we have developed a device to stimulate the same location with the same force as PT's interventions. So these like left pictures shows our prototype. We use air actuator to stimulate the sole of the foot. And also, since the foot size changes due to the growth of the children, so this device was developed with a 3D printer to easily change their size and to adjust the different body size. Also, this right picture shows like new version of the device. Now we utilize a like pin array to stimulate any target location. And this device can measure like COP, so the children can play a game. They are asked to control the hammer with a COP to hit a mole. So the patient could train voluntary sway while receiving the stimulation on the sole. Here are the like preliminary results of the effect of the developed device. So like the PT's interventions, like center of pressure decreased after receiving stimulation from the device. And furthermore, muscle activity decreased. So this indicates that the developed device could be like effective to improve body representation in the brain. However, like some difficult problems remain, such as rapid change in body size due to the growth period. So this left movie shows a locomotion of 10 years old child, and the right movie is after 4 years. You may see that actually the stride length got shorter in the right one. The child keep receiving the rehabilitation, but his body representation cannot like catch up the sudden growth of the body size. So the body weight actually become about like twice for these 4 years. So our like next challenge is to develop the methodology to overcome like this gap. So here is a summary of my talk. So PT's intervention may improve embodiment. It aims to shape the mechanical structure of the body and improve sensory input from the foot sole. The motor function actually improved, so CP children could stabilize their posture in a static and dynamic conditions. Also, their perceived like reachable distance increased, which means that the improved self-efficacies. We also show the development of stimulation device replicating PT's intervention, and it can adjust to different body size and could improve motor functions. And that's all from me. Thank you for your listening.